Hello everyone, today I'm doing a video related to the interview questions and tips for a PIP Assessor job role in the UK. So basically my name is Reshma, I'm a nurse PIP Assessor in the UK for DWP. So I'm doing that in a presentation format so that it would be easy for you to take notes and pause and read through the sample answers, and that would be better for you to kind of grasp, I thought. Well, so the contents I am including in this video is the type of questions being asked. So there is like different sections of questions being asked. So what were my interview questions? What were the sample answers, tips and points to include? So let's move on. So first, just let me tell you the selection process of a PIP Assessor. It includes 2 stages: online test and interview, face-to-face or the video interview. So stage 1 needs to be passed for you to kind of move on to the section 2, basically stage 2, basically the interview. So it is an easy test, to be honest, so that I will discuss at the end of this presentation. Let's move on to the stage 2 interview first. Okay, so interview format that I had was this. So basically, you've got 4 sections. First one is warm-up question. This is just one question which is not being scored. Second is just, again, one question asking about the reason why you have applied for this job role. Third section is the strength-based questions, 10 questions in this section on different 10 areas. And fourth is a clinical scenario where you would be given a scenario and there will be 4 follow-up questions. Okay, so first section. So as I said, there is no score for this question. So why they're asking this warm-up question is basically for you to kind of reduce the anxiety, to be honest, like to ease your nerves and to maintain a good relation with that interviewer. And it would just give you it will give an insight for them basically about their personality, what personality you are as well. But basic reason is for a smooth transition, basically, so that it is not scored, so you don't need to be kind of like worried about what you tell during this section, to be honest. So my warm-up question, it was, tell us about an activity you enjoy. So keep it simple, don't overthink. My answer was dancing. So I've just told them, so I like to dance, and it is something that I have been trained back in India to do some classical dance. So I do that every day, which helped me to relax and things like that. So just add what is, just think about the activity that you love, and then just, give us simple answer. Just don't overthink, just a simple answer. It will help you to kind of, you will smile on that section, to be honest, like after they will be saying like, oh, that's good. And kind of, that way you will kind of reduce that anxiety kind of, it will help you to kind of go to the next section. Right. So then question 1, basically it is question 2. But this is the first question which has been scored. Okay, reason for applying job role as a PIP Assessor. Points. So the points are passion, relevant skills, shared values, our growth opportunity, kind of our growth mindset, team contribution, the ability to contribute to the team. So these are the points that you need to kind of include in there. What I would suggest, look into the website of the company you are applying for. Look into the mission, vision statements, and there, there would be like videos or like, experiences and things this nurses or like PIP assessors have shared and everything. So you'll get the overview of how they are doing, what are their values and everything related to them. So make sure you integrate everything into your strengths and, your kind of passion and everything, kind of integrate everything into that answer. So I'll just give you a sample answer there. So if you want to read it, just pause the video now and read it and come back to the next section. Okay, right. So what I covered in that, sample answers is my experience, my recent job role, and the skills developed throughout my journey, the research knowledge, communication skills, transferable skills, like, the IT knowledge, or like, the care plan, or like patient assessment, kind of, about, the ability or the skill of, history taking, your adaptability, like being a quick learner, adaptability, passion for helping others, career goals, and things like that. So the third section, so this is where the strength-based interview questions are starting. So as I said, it is strength-based, not competency-based. So what is the difference basically? So I'll tell you a brief. So strength-based is what is looking at your motivation. So what motivates you? But in competency-based, it's basically looking at your skills and experiences. Let me give you an example. So strength-based interview, the question is like, how do you ensure a task is done at the highest possible standard to provide excellent patient care? So here, which is looking at your kind of motivation, what would you do kind of that way, not like what you have done before. Just in the competency-based interviews, it would be like, tell me about a time you analyze complex information to make a decision. So that is kind of the difference basically. So the strength-based questions were looking into 10 different areas basically. So those were task completion, accountability, rapport building, learning agility, professional development or growth, analysis skill, explainer skill, resilience, conflict resolution, and inclusion. So the most important tip: divide every answer to 4 sections, just in your mind. Right. Follow that method. First is give the overview of your strength and experience in that field. Next, give the example. Third, describe the outcome. And 4, reflect, basically the lessons you have learned. So you will understand when you go to the next section, and I'll just explain to you how I have done that. So let's move on. Basically, how do you complete a task to highest standard for providing excellent patient care? This was my first question. So the strengths we can include in there is our strong attention to detail in all patient interactions and documentation skill, our ability to prioritize tasks, organizational skills, empathy, compassion, patient-centered approach, etc. So the sample answers is here. So I have divided this answer into 3 different sections, basically 4, to kind of, for you to understand how we are going to kind of moving forward, going to tell the answer. First is overview. Just read that, like, to provide the best patient care, I focus on being detail oriented and communicating well with my team. And just give that example. So we are giving medication administration as a task here, and then how you did that, how you delegated it, how the teamwork, adequate communication, everything I have included in that example. If you pause and read, you would understand. And the outcome and reflection I have included in the third, paragraph there. So this is format you have to kind of, think about when you answer the question. So the next question was, tell us about last time you took ownership of a problem to provide outstanding service at work. So the strengths that you could include is proactive in identifying issues. So problem identification, skill in problem solving, communication, and a commitment to follow through and ensure safe, satisfactory outcomes. So the sample answer, here we go. And it is divided into 3 sections there. So it is basically overview, example, and the result or the outcome and the lessons learned. Okay, right. So the third question, how would you build rapport as PIP Assessor? So you can include these strengths in there, basically the empathy, active listening, being open and approachable, interest in, basically creating a meaningful connection with the people, consistency and reliability in interactions. So these could be included in there. So this is my sample answer. You can pause and read if you like, and we'll move on to the next section, that is the next question. If you need to learn a new system, how would you approach and learn how to use it? So basically, this is what we can add here as our strengths is the curiosity and willingness to learn, problem solving, time management, adaptability to the new technologies, and effective research skills, ability to seek and utilize feedback, and persistence in overcoming challenges. Sample answer. Here we go. So you can pause the video and read the sample answer. So the next question is question 5. What opportunities have you taken from others and past experience for growth? So this is basically looking at our growth mindset. So openness to learn from others. So mentorship, willingness to seek the mentorship, ability to analyze past experience, your professional and personal development commitments, and your interest in collaborative learning. So the sample answer is this, and you can always pause and read, and you can come to the next question is, how do you analyze complex information from multiple sources? So basically the strength is basically our ability to look into the different data and analyze the data and interpret the data, organize, and communication, critical thinking to provide excellent care for the patients. So here we go, the sample answer. Right. Okay. So the next question is, when sharing complex information, what is important for you? Keeping it simple or providing full information? So this is basically looking at our explainer skill. So we can always add the confidentiality thing in here as well, like, only give enough, only essential information to people. The confidentiality can be, added into this section. But here it is looking at the explainer skills as well. So the ability to tailor communication to the audience level of understanding. So that is what it is looking here. And basically, because as a PIP assessor, you will be making rapport and sending it to the case manager who is not health professional. So the ability to basically, explain the things in non-complex manner. That is what it is looking at this question. And you can always say, only give enough information to the whoever who is needed, and don't share the information. Everything related to confidentiality you can include in there, but this is what it's looking there. Okay, right, this is my sample answer there. Right, you can pause and come to the next question there, which is, how did you deal with an unexpected situation in the past? So basically resilience and problem solving, that is what it's looked at here. So this is my sample answer, and please feel free to read and come to the next question. Right, so question 10, what are the benefits to work with people who has different opinion to myself? So basically looking at inclusion and conflict resolution in the background there. Right, so our openness to diverse perspectives and constructive feedback, that is something which is looked into here. And interpersonal skills and the ability to appreciate and harness different viewpoints to improve decision making. So the inclusive team culture, our kind of commitment creates that inclusive team culture. That is what we have to emphasize here. So this is my sample answer. You can always add your personal touch into it, add a specific example, add more details into it, and then it is something which is, it is good to read and refer, and go and make your own. Yeah, there we go. And next, the tip. So as I said, so for all question, overview, example, outcome, reflection. Think about this always. Okay, let's move on to the section 4, that is the clinical scenario. That is the last section of the interview. So this is 1 scenario and 4 follow-up questions based on data collection and approach to patient care, safeguarding, and critical thinking and problem solving. Right, so clinical scenario. This was my scenario. A person named Mrs. Jackson, age 34, endometriosis and depression. So the concerns were she is, at a routine checkup, this lady feels very low and unable to cope with daily responsibilities, especially while managing her children at home. She reports feeling of hopelessness and has increased her alcohol consumption as a coping mechanism. Her mother assists her occasionally, but she expresses concerns about managing her mental health and home life effectively. So the follow-up questions were these ones, so that we will be discussing one by one in the next section. So first is evidence gathering question, that was specific symptoms or changes in Mrs. Jackson's behavior would indicate the severity of her depression and how it may be affecting her ability to care for her children. So basically the things that you need to include in this question is that we would assess the necessary information. We would gather all the necessary information. These are the examples of what you could gather, like assess the mood changes, sleep pattern, changes in appetite and energy levels, the social isolation, those things, suicide or self-harm things, and also because it was saying alcohol consumption as well, you can ask regarding alcohol, how many units they are taking and things like that, so and so. So this is just an example. So second is approach to patient care question, that was what strategies would you implement to address both Mrs. Jackson's endometriosis and her mental health during her treatment plan. So basically making the comprehensive care plan for physical and mental health, and basically coordinating the multidisciplinary team and regular follow-ups and providing education or like leaflets or signposting to this for help, and exploring treatment for pain relief and mood improvement, and helping her to connect with the support groups, and so on. So safeguarding question. So because she's got children, the safeguarding, always think about family, always think about safeguarding. So this question was, given Mrs. Jackson's increased alcohol use and feelings of hopelessness, what safeguarding measures would you consider to ensure the safety and well-being of their children? So basically conducting thorough assessment, discussing the capabilities and stresses, involving social care services if involved. So basically assessing the risk of harm. So we'll assess the age of the, children back home, the support she's receiving, or we can so basically get proper information about the lady, and involve social care services if needed to, signpost her to resources if it is mild, or discuss strategies to ensure children's safety and promote positive parenting. So, and the fourth question, this was the last question, basically on critical thinking and problem solving. If Mrs. Jackson continues to struggle with coping despite interventions, what alternative strategies or resources might you explore to support her mental health and family responsibilities? So basically connecting her to the psychiatrist, connecting her to the support groups, helping her to manage the situation, connecting her to alcohol or substance misuse, or the team to if she's dependent to the alcohol at the moment, alcohol dependence team, or the teams to help her, and also give her the information related to the crisis team if she's experiencing those self-harm or suicide thoughts and things like that, and always inform the GP, etc. Right. So as we've already discussed regarding the stage 2 now, that's completed. So as I said, stage 1 is online test. So basically you would be given a link to go to their website initially and do this test. So it's under an hour, and you will be given a time frame 48 hours to do that and finish the assessment, online assessment. Basically the question types basically they are asking is ranking question, sliding scale questions, some writing a simple answer question, and recording video So recording video responses basically, it doesn't kind of include rocket science or anything. So basically, the thing is, you would be asked a question, and then it is under 2 minutes, I think. You have to record that answer. You just need to, put your face, you have to record yourself basically on camera and answer that question. So just follow this step: overview, example, and outcome, and what I said, like reflection. So that's basically you need. So I think I was being asked related to the communication. So I have been asked, how would you make sure you would do a proper assessment for an autistic patient or something like that. So I remember that I was saying, reasonable adjustment, giving adequate time for them to respond, adequate environment, the clear open-ended questions and things like that. So that is basically in the video response. And the sliding scale, the question is basically so what, say for example, how would you rate your communication skill is like? So it would be excellent, great, good, fair, kind of, poor, that way. So you can kind of do that response there. Right. So, right, let me go to the next section. So basically the points from the online test and the points in the face-to-face interview will determine whether you would pass or fail. So there is set points for the test as well as set points for the interview. So basically the bonus tip is try to score high in the online session because it is so easy, as I said, and it is just, there is nobody to kind of, look or guide you through the process or anything. You can take your own time, but it is recommended by them to kind of do that in one sitting. But you've got 48 hours to complete, and every section is not timed.